Okay, I'm just going to go through a hip flexor stretch, which is really useful when you get low back pain caused by facet irritation. Now, facet irritation is irritation of the facet joint, so I'll come in a little bit closer so you can see there. So that would be the right, that would be the left facet. So as the spine flexors and you bend forwards, they open up. As you extend and arch back, they close up like that. Side bend to the left, you see the left facet becomes irritated or compressed, and then side bend to the right, you see the right one. So you'll find with facet irritation, with extension, that's generally going to be more painful. So extension being arch back. And the reason with a lot of people why there's facet irritation there in the first place is because the person naturally has an anterior tilted pelvis like that, which extends the lower back through there. So if I show you on here, anterior tilt of the pelvis, you can see how the extension increases through the lumbar spine. Okay, so people that have got a natural posture to anteriorly tilt is just going to extend it a little bit through there. But also you have a sway back posture. So people with a sway back posture, they stand and they just let their hips fall forward and then they sway back like that, and they just sort of sit into their pelvis through the lower back, and it actually extends the lower back through there. A lot of people find that's just comfier, but it's comfier because it's not using as many muscles, so it's not taking up as much energy, so therefore feels a bit easier. The abdominals become weak, hamstrings become tight, calves become tight, lower back becomes weak, and then hip flexors become extremely tight. So to stretch those off, we're wanting to stretch the anterior structures. Rectus femoris, which is the quadricep, comes up through, attaches through onto the front of the pelvis there. The ASIS, that bone there, if that's tight, it pulls it down and anteriorly tilts that way. Psoas comes up and attaches onto the transverse processes of the lumbar vertebrae. Again, as that comes through, if they're tight, it's just going to pull the lower back into extension. To stretch a pair of them, if you get something like a bed, sofa, chair, anything that sort of height, put a pillow down on the floor for your knee to rest on, stand away from it, ankle onto it, and all you need to do is just lunge down through like that. Okay, so it's really easy once you're sat just to sort of have it there as a prolonged stretch. A little bit easier than if people were to do a quadricep stretch, rely on balance and then rely on sort of pulling on like that. It's okay for a few seconds, but if you wanted a prolonged stretch, it's not going to be that comfortable. Okay, so have the ankle pulled up into there, quite close to the sofa, and then your hips, I'm just going to push them forwards a little bit so I can really feel that pull into the front there. What a lot of people do is lean forwards like that. That's just going to take the tension off the psoas. As I mentioned, they come up through and attach onto the front of the spine. So if you lean forward, you're just going to take all that tension off. You're going to stretch the quad, but not the psoas. You want to do them both like that. So nice and straight. Don't let your lower back fix into extension as it pulls it through like that, because that's just going to aggravate the facet irritation even further. So nice and straight, stomach tight, and then bring your hips forward like that. Okay?
Okay, it will depend on your height what you could use for this, but something like a chair or a bench would be a good start. Here I'm stretching my right psoas, so I want to make sure I tense the right glute to engage that and then relax the psoas. And then I'm going to lean forwards and then feel the stretch into the right psoas there. So here I'm using my arms as a straight line just to show the angle of what my spine is, and then I'm moving just to show how to go into the stretch. But obviously as you're doing it, it's going to be a static stretch. So here I've actually relaxed my glute muscle just to show how far forwards you do go without that glute activation. So this isn't the right way to do it, as the psoas muscle isn't going to be properly stretched. Alternatively, rather than using a chair or a bench, you could do it in a kneeling position. So the same rules apply. Make sure that you activate that glute just to relax the psoas muscle fully, and then just lean forwards at the same angle through there. You'll find you probably won't be able to go quite as far this way because the knee is bent. The rectus femoris, which is the quadricep muscle, is going to be put on stretch. And then here again I've relaxed just to show how far forwards it goes without that glute activation.